not the same. I understand what you're saying. You want to see this, right? Where here we were looking at millivolts, depolarizing, repolarizing. Yeah, it's a different kind of thing. Each one of these deflections is not depolarizing and repolarizing. Each one of these deflections is just a change in potential. So it's not direction specific. You know what I'm trying to say? So all we're saying is you're at rest here, and then now you're not at rest. You're back at rest here, then you're not at rest. You're back at rest here, then you're not at rest, or whatever. So we're just seeing electrical events. So rather than using the words like depolarize and repolarize like this, it's just that this electrical event represents this depolarization up here. It's just recorded differently. This electrical event over here represents this repolarization back here. Okay. So they're a little bit different. So these are just deflections or electrical events rather than depolarizations and repolarizations by a tracing. So this is called, this tracing is a ECG or EKG tracing. We use it to indicate defects or issues with the cardiac cycle. It is purely electrical, but you can see that if there were changes in this electrical tracing, it could affect the mechanical events in the blood flow. Okay, so we'll practice coordinating or looking at normal and abnormal EKG tracings with normal and abnormal cardiac cycles in terms of mechanical events. Okay, but this is really just looking at electrical activity. It's just looking at some electrical activity in the central part of the thorax, and those are responsible for that. Okay. So that's one thing to study, is everything that happens in a heartbeat. And certainly that affects your cardiovascular system because that affects the ability of your heart to distribute blood to the tissues. But what's really more important, and if we're studying blood flow, what's really important is that to really look at the efficiency of something is to look at the flow. This is only one aspect of generating pressure to have flow. It's dependent upon certainly being able to have atrial systole and diastole, ventricular systole and diastole. That's important. But in terms of flow, what we really want to look at is how efficient, so the efficiency of your heart. And I don't know if you ever, like any pump, the efficiency of a pump is always measured in volume per unit time. The most efficient pumps pump the most fluid in the least amount of time. Lesser efficient pumps pump less fluid in the least amount of time. Okay. So we want to look at the heart as a pump and talk about its efficiency of being able to allow for blood flow, and this is certainly going to be part of it. What my liver, for example, doesn't